Good afternoon, Ma'am Jonaline Corpus. I'm Eunice Shara Buksit from Section B. I'm a nursing student from Chiles College. Today, I'm going to perform the skill cardiopulmonary and peripheral assessment. So, the purpose of this skill is to perform a systemic approach to cardiopulmonary, vascular, and peripheral assessment. They gain nursing history and ask questions that will help the nurse focus your cardiovascular assessment. Recognize abnormal cardiovascular assessment findings associated with inspect, auscultation, percussion, and palpation. The overview of this skill is a thorough assessment of the heart provides valuable information about the function of a patient's cardiovascular system. Understanding how to properly assess the cardiovascular system and identifying both normal and abnormal assessment findings will allow the nurse to provide quality, safe care to the patient. The physical examination of the cardiovascular system involves the interpretation of vital signs, inspection, palpation, and auscultation of heart sound, as the nurse evaluates for sufficient percussion and cardiac output. Next, the peripheral vascular examination provides valuable information on general health status and can help to determine the status of the arteries and veins.
Good afternoon, sir. I'm Eunice Shara Buksit. I'm your student nurse for today. So, sir, can I ask your name and your birthday?
My name is Ashton Clyde Perisena and my birthday is November 19, 2008.
So today, sir, I'm going to assess your thorax, lungs, heart, and peripheral extremities. So, sir, I'm going to interpretation of your vital signs, inspection, palpation, and auscultation of your heart. All the findings po na nakikita sa inyo will remain private po. So, sir, first, I'm going to perform hand hygiene and I'm going to drape you before starting the assessment. For your privacy, I will place the curtain. So, sir, first I'm going to ask you your family history po. So, sir, do you have in your family na nagka-cancer po? Do you have any allergies? Tuberculosis? So, your lifestyle habits po, are you, nag-smoke po ba kayo? Naggagamot po ba kayo? Third problem po, swelling, coughing, wheezing, pain. So, sir, next is presence of disease that affect the heart. So, do you have any diabetes, sir? Lung disease? Endocrine disorders? Lifestyle habits that are risk factor for cardiac disease like smoking, alcohol intake, eating and exercise patterns, areas and degree of irresponsive. So, sir, mataas po ba yung blood pressure niya? Stroke, obesity, PhD, arterial disease, hypertension, heart murmur, heart attack, varicosities, present symptoms like fatigue, dyspnea, or fatigue, edema, cough, chest pain, palpitation, syncope, hypertension, wheezing, hemoptysis. Now I'm going to perform hand hygiene. of the client. The anteroposterior to transverse diameter ratio of 1 to the client's spine is vertically aligned. Next is I'm going to assess the lateral deviation of the spine of the client. The client's spine is straight, right and left shoulder and hips are the same height. Next is I'm going to palpate the posterior thorax. Is warm temperature. The chest wall has no tenderness or any masses. Next is I'm going to palpate the posterior thorax for respiratory excursion. Full and symmetric thorax expansion. So my tongue is moving apart in equal distance at the same time when the patient is breathing in and out. Next is I'm going to palpate the thorax for vocal tractile primitus.
Lumon. 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 Lumon.
So the normal findings is bilateral symmetry or vocal primitus. Primitus is heard most clearly at the apex of the lungs. So next assessment is I'm going to percuss the thorax. normal finding of the percussion of the thorax. So the resonance is the percussion tone elicited over normal lung tissues. Percussion elicits flat tone over the scapula. So lowest point of resonance is the diaphragm, level of 8 to 10 grade rib posteriorly. Percussion of the rib normally elicits dullness. Lastly, I'm going to auscultate the thorax using stethoscope. But first is I'm going to disinfect my stethoscope. adventitious sounds such as crackles or wheezes are auscultated. Next is, I'm going to assess the anterior thorax. First is, I'm going to inspect the breathing patterns of the patient. The patient's respiratory rate is normal. Note, the patient is not breathing difficulty. His breathing is quiet, rhythmic, and effortless effortless respiration. So the costal angle of the patient is less than 90 degrees, and the ribs insert the spine approximately a 45 degrees. Next is I'm going to palpate the anterior thorax. Comes normally separate 3 to 5 centimeters. Next is I'm going to palpate the tactile primitus in the same manner as the posterior thorax and using sequence movement. Primitus is normally decreased over heart and breast tissues. Next is I'm going to percuss the anterior thorax systematically. Percussion notes resonates down to 6 deep at the level of diaphragm, but are flat over areas of heavy muscles and bones, dull on areas over the heart and the liver, and tympanic over the underlying stomach. Next is I'm going to auscultate the anterior thorax using the stethoscope. Auscultating the anterior thorax, just like the posterior thorax, the sound is normal. Next assessment is assessing the cardiovascular system. First is I'm going to simultaneously inspect and palpate the record you for the presence of abnormal pulsation. So first is I'm going to locate the angle of Louis. So first I'm going to locate the angle of Louis. Here is the sternal notch. Here is the angle of Louis. Next is I'm going to locate the aortic area. Here is the aortic area. Second intercostal space. Here is the aortic area. Next is I'm going to down into the fifth intercostal space. Close to the sternum is where the tricuspid located. Or right ventricular area. Next is I'm going to inspect and palpate the epigastric area at the base sternum for abdominal aortic pulsation. The normal findings of the patient is pulsation visible in 50% of adults and palpable most in PMI, and fifth, LICS at or medial to MCL. No lift or leaves, no lift or heaves, and lastly is aortic pulsation. Next is I'm going to auscultate the heart in all 5 anatomic sites. First is the aortic area. So the aortic area is in the second intercostal space at the sternal border, the base of the heart. Next is, so here is the aortic area. Next is I'm going to auscultate the pulmonic area, which is in the second or third intercostal space. Next is the pulmonic area, which is in the left is sternal border, second or third intercostal space. So here is it. ERB's point. ERB's point is in the third intercostal space. At the left is sternal border. Here. Is it? Going to locate the tricuspid, which is in the fourth or fifth intercostal space, which is here. Tricuspid area, fourth or fifth intercostal space at the left lower sternal border. Here is the tricuspid area. A mitral area or apical, fifth intercostal space near the left mid-clavicular line, the apex of the heart, which is in here. Next is I'm going to auscultate both S1 and S2. Patient is S1 usually heard at all sites, usually louder at apical area. S2 usually heard at all sites, usually louder at the base of the heart. S1 corresponds with each carotid pulsation and is loudest at the apex of the heart. S2 immediately follows as S1 and is loudest at the
base of the heart. Next is I'm going to auscultate the carotid arteries. Artery, the normal finding is systemic pulse volumes, full pulsation, trusting quality. Quality remains same when client breathe, turn heads, and change from sitting to supine position. Next is, I'm going to auscultate her carotid artery using the bell of my stethoscope. The carotid arteries, no sounds heard on auscultation. So I'm going to auscultate the jugular veins. So I'm going to measure her jugular veins using a metric ruler. The normal findings of the patient's jugular vein is veins is not visible. Next is I'm going to assess the peripheral system. So I'm going to palpate the peripheral pulses on both sides at the same time. Of the patient, peripheral pulses, all the systemic pulses volumes full of pulsations. Next is I'm going to assess his peripheral veins. Of peripheral veins is in independent position, presence of distension and nodular bulges at valves when limbs elevated, veins collapse. Next is I'm going to assess the peripheral leg veins for sign of phlebitis. Assessing the peripheral leg veins for site of phlebitis. The normal finding is symmetric in size, limbs not tender. Next is I'm going to assess the peripheral perfusion. I'm going to inspect the skin of the hand and feet for color, temperature, edema, and skin changes. The skin color is pinkish and her body temperature is warm. Next is I'm going to assess the capillary refill test. So I'm going to press at least 1 ml on each hand and foot between
the thumb and index finger. For the normal finding, the capillary refill is immediately return of color.
After the procedure, assist the patient to comfortable position, thanks the client for her or his cooperation and offer assistance whatever needs of the client that may arise, place the call bell near the client. Since I don't have side rails, always side rails up for safety of the client. Gather all equipment and dispose all disposable supplies that was used.